Hi, good afternoon, everybody. Have you ever heard the saying, a smile says 1,000 words? Well, it most certainly does in many more ways than one. Our mouths are the gateways to our entire internal selves. Without its regular care, the very foundation that we're made of may begin to crumble from the inside out. In my 14 years of experience as a dental assistant, I have seen the worst cases of oral hygiene improve drastically with the help of many well trained dentists. Good oral hygiene helps to improve overall health. I'll talk about my topic in three parts. First, people's general oblivion to the importance of oral care. Second, our country's contribution to our poor oral health. And third, the positive outcomes from proper periodontal maintenance. Oral care is often overlooked by society. Melinda Beck, a columnist from the Wall Street Journal, stated that some of the earliest signs of diabetes, cancer, pregnancy, immune disorders, hormone imbalances, and drug issues show up in the gums, teeth, and tongue, sometimes long before a patient knows anything is wrong. Between the anxiety and fear people experience during a visit to the dentist and general lack of knowledge about proper oral hygiene, it is easy for a person to ignore their dental needs and only seek care when they experience pain or discomfort. The most common dental issues include cavities, gingivitis, and periodontitis. These dental issues can cause strain on other parts of the body as well. For example, an untreated tooth abscess, if ignored, could possibly lead to death. Between the years 2000 and 2008, studies show that 61,000 Americans were hospitalized for a periapical abscess, which is an infection at the root of the tooth. Of the 61,000 people, 66 of them passed away during their hospital stays. This proves that dentistry is the least of our worries regarding staying healthy. But all in all, as stated by Dr. Caswell Evans, Associate Dean for the Prevention and Public Health Sciences at UIC College of Dentistry, the significance of the mouth as part of our health is often overlooked and underappreciated. Now let's talk about another reason for the consistent rise of dental diseases in America. Poor oral health is most common in minorities with low income and no dental insurance. About every 3 in 4 Hispanics and African American adults are most likely to have poor oral hygiene due to lack of income and no medical coverage to meet their needs. An article for the Centers for Disease Control and Prevention on facts about adult oral health states that for every adult aged 19 years and older without medical insurance, there are 3 who don't have dental insurance. That means that more than 26% of adults in the United States have untreated tooth decay. A lot of minorities in the United States have Medicaid coverage that doesn't include dental benefits. Each state has its own benefits that require coverage for children, but it's not mandatory for adults. A New York Times article shows that as of January 2018, only 17 of our 50 states offer comprehensive dental care for adults. Therefore, many people in the United States go about life ignoring their dental needs simply because they cannot afford it. A study published in the Journal of Health Economics showed that people with active Medicaid dental coverage have increased chances of visiting their dentist regularly by 22%. This proves that our current benefit system is hurting those in need of serious dental treatment. Next, to discuss is the breakthrough in financial gains when proper dental care is delivered to patients with serious medical issues. Gum disease, if treated, can improve other serious medical issues and save people money. As I mentioned earlier, periodontal disease is linked to many other serious illnesses like diabetes and heart disease. Studies show that when these patients finally receive the necessary dental care they need, they were able to save money on their other medical expenses tied to all the other illnesses they have. In America, Patients with type 2 diabetes saved 40% on their medical costs after they treated their periodontal disease, and patients with coronary artery disease saved 11% on their costs as well. Suzanne Allard Levingston, a freelance health reporter for the Washington Post, Bloomberg Businessweek, U.S. News and World Report, stated that nearly half of all Americans aged 30 and older have some form of gum disease, with 70% of them aged 65 and above. The elderly tend to have the most health issues as they get older, so the benefits of treating their periodontal disease would help them tremendously financially and medically. With that being said, I want to finish up with these final thoughts. I highlighted 3 important things. First, it is important to stay well informed about what's going on in our mouths so we can fix all problems before they get worse or cause further damage. Second, dental insurance coverage is a necessity to us all. And third, consistent perio upkeep will help to improve not only our gums, but the rest of our bodies as well. Good oral hygiene helps to improve overall health. Our smiles and our mouths have much more power than we know. Not only to speak up for what we need, but during a routine dental checkup, we may become privy to many other issues we had no idea about. Dental knowledge is key to a much cleaner, healthier lifestyle. Never ignore the signals our bodies give us, including inside our mouths, because we need every working part in order to function properly. Thank you.